With the widespread attention on obesity in North America, more people are trying dramatic weight loss strategies.
Things like gastric bypass and strict diet and exercise programs can certainly achieve massive weight loss, but the after effects are causing a new problem for patients. Our health reporter Pauline Chan has more on that. Pauline?
Thank you very much, Ken and Andrea. Well, it's great when patients can achieve and maintain significant weight loss, but losing 60 pounds or 100 or more can leave a person with saggy excess skin, and many are now turning to plastic surgery to correct that problem.
I've been yo-yo dieting pretty much all my life, which is really bad, and I've been as high as 240 pounds.
A few years ago, Mary underwent gastric bypass and was successful at losing 60 pounds.
I just thought, what's the purpose of losing the weight and then having the skin to deal with?
The excess skin she was left with is typical for patients who undergo massive weight loss, and Dr. Martin Jugenberg understands the kind of problems that folds of skin and moisture can cause.
They have irritation, they have recurrent infections, chronic pain, chronic problems. You can see in these pictures, she had an extra fold up above the belly button, an overhanging amount of skin on the belly, and so what we did for her was remove all the extra skin. We don't really have statistics for Canada, but in the States, there are approximately 200,000 bariatric surgeries performed per year, and the latest statistics by the American Society of Plastic Surgeons show that about 50,000 of these patients then go on to have body contouring procedures, with the tummy tuck representing the largest number of these procedures.
Thighs, arms, and necks are also common areas where weight loss leaves sagging skin. Dr. Jugenberg says plastic surgery to remove excess skin is only for those who have already completed their weight loss and maintained their weight for at least 3 months, preferably more.
Someone who is in a BMI of over 40, for example, has a significantly increased risk of complications such as blood clots and other complications during surgery and wound healing, and also their cosmetic results are not as good as somebody who is in a BMI less than 30.
For Mary, who went for her plastic surgery 2 years after her weight loss, the transformation has prompted her to buy her first bikini ever.
I mean, I'm not a model or anything like that, but it's wonderful to be able to do things that a lot of people take for granted. But you know what?
And regardless of whether you end up going to see him or not, Dr. Jugenberg says patients who are recommended for bariatric surgery should look into the matter because the health benefits of weight reduction are so important. With today's Lifetime, I'm Pauline Chan.